So I'm here today with Dr. Stephen Curtis from EyeLux Integration around syntonic optometric phototherapy technology. And this is just amazing technology that is helping a lot of people. And we want to talk about this today in our series about healthcare and technology. Dr. Curtis, can you introduce yourself?
Sure. Thanks for having me, Ted. And I'm from Columbus, Ohio. Dr. Stephen Curtis, home of the Buckeyes. And I practice general optometry, but I specialize and spend a lot of time in an area called therapy, vision rehabilitation, so that we can help patients that are not just having trouble with structural vision problems such as glaucoma, needing eyeglasses and contacts, but also functional vision problems. That's what this is. Emphasis is on that aspect of patient care here in our clinic.
So what type of patient would this technology apply to?
Yeah, this technology that we're referring to, syntonic optometric phototherapy, applies to any patient, just about anybody who's suffering functional vision difficulties. What are functional difficulties regarding vision? Well, the eyes are cameras. They just take an image, but there's a hard drive that processes that. That processing of vision happens in the brain, many areas. Hundreds of thousands of areas in the brain process vision. So any patient this can be applied to who's suffered a delay in those pathways being developed, such as children, patients who have suffered a concussion, TBI we call it, stroke patients, and of any age.
So what technology, I see the cameras back here, but what does the technology really do? How do you use it?
Well, these are emitting light transmission through glass. So light, natural light, transmitted through specific glass filters that are designed, customized to allow us to prescribe specific ranges of frequencies of visible light. So the emission out of these instruments will be specific to what the patient needs.
So the light goes into my brain and fixes my brain, right?
Yeah, because your retina or your eye is the greatest access to the brain that we can send information through. 70 to 80% of information reaching the brain is coming through the visual pathway. So
Okay.
this is applied to the eyes of the patient. The retina, which is neurological connection to the brain, structurally and physiologically. And then that sends the energy down the pathways into those hundreds of thousands of pathways into the brain, allowing for these pathways to move by way of electronic action potential, energizing these pathways for rehabilitation or development of just enhancement of skills that can't be addressed with glasses, contact lenses, surgery, and so forth.
So there are the different visual therapy products that do some things like this, but what makes what you're doing? By the way, and it's, the idea of putting the light into the brain is just brilliant. But how's it different from other visual therapy products?
Yeah, light coming into the brain or light going through the tissue. Medicine and optometry, a lot of fields are finding out that, wow, the power of light is incredible. We're rediscovering that over the last decade, especially. So lots of research and literature that's backing this. It's really exciting to be in the field of light. But the question again was?
How was it different from other vision therapy products?
Okay. So how this is different from other vision therapy products is because it is passive application of treatment versus active. So what the difference is, it's all input. It's like taking a patient, taking their brain, putting them through an input of therapy only passively versus when we do something that's more active therapy, it's teaching, instructing. They have to use their brain for cognitive reasons when we're doing certain active therapy processes. So that's what's special about this. It's like the IV in the hospital and the ICU is just passive treatment to the patient. We're not getting them up and ready to walk yet. They're not ready for that. So this is how that's based on foundational input first before we can go output and expect any progress. We've got to get a foundation built for that patient.
So I know there's two different systems that you have there. One is for the home use and one is for the office use. And I think that's a big differentiator for what you've been doing with your work. Can you just explain a little about that? Because I know it's a little confusing.
So the light that's emitted from this instrument will be used in the office of a doctor
Hmm.
for treatment and for testing of frequencies of what we want to maybe continue treating the patient with. And then once we decided that, the patient can come into the office several times a week for the treatment. But with society today, they really want convenience. And so we have some home therapy options, but they can't match the quality and the power of the in-office instrument. Now we do have that. This is an instrument that is a miniature version of this without all the prescriptions available in it. In other words, all the filters of glass emissions aren't available in this, but we can send home a specific unit based on what that patient needs, based on the testing protocol here. So we can hybrid. Most offices are now wanting to hybrid with home treatment, send the patient home so they don't have to make so many trips to the office, and then keep this in the office for use.
Awesome. So the talk a little bit about how your patients are using it. You've talked before with me about victims of car accidents and so forth. Can you talk a little bit more about that and how is it being used?
Well, my favorite patients that I use this on are the brain injured patients, the concussion patients especially. There's 3 million that enter the emergency rooms yearly, and that is TBIs, can be from any reason, but that concussion patient, the middle school, high school, little league get concussions. They're supposed to recover from them within 2 weeks. So if you go to the emergency room, they are usually instructing you to rest. You'll be fine in a couple weeks. But 15% of these concussion patients do not recover fully within 2 weeks. It takes them several weeks, several months, or years. So what we do here is provide an acceleration of their recovery. We don't treat the concussion directly. We treat the vision dysfunctions that are caused by the concussion.
Right.
Since concussion can rattle that brain in all those hundreds of thousands of pathways that are vision based, not just seeing based. Okay, we have seeing pathways, but we also have non-seeing pathways for vision in the brain that most people don't know about. So that's why this can facilitate and accelerate the recovery of those pathways, which then enables the brain to recover from the concussion. Remember, 70–80% of the pathways in the brain are dedicated to vision. That's why vision intervention is so powerful in concussion treatment.
Well, thank you so much, Doctor, for your time today, and really appreciate it's amazing technology
Yeah,
and
fun.
fits into what we're talking about technology and healthcare really well. Thank you
It's
so much.
so fun, so fun. Thanks for having me.